Hi everyone, good evening. Welcome to another Instagram live by Dr. Sanjeev Rampal on Rampalsurgery.com. So we're just going to wait for everyone to come in. Hi Sabrina. So today we're having a talk on sleep and we'll be joined by my guest who is Dr. Raymond. We'll be waiting for him to join in. Raymond, join Instagram.
Okay, bro. Okay, here.
Hi Dr. Neela. Dr. Neeta. Welcome to Instagram. We're waiting for my chief guest to join in. We'll wait for a little bit longer for everyone to join in on our Instagram live at 5 o'clock. Okay, excellent. Dr. Raymond has joined in.
Hi.
Hi, excellent. Dr. Raymond.
Oh, how are you? How are you? Okay, good, good. Okay, we are. Let me
Okay,
see. We are
yeah,
putting it this way, yeah.
yeah,
All
we'll
right, all right.
start soon.
Okay,
Time
good,
to
good.
coordinate yourself and give me 2 minutes.
All right.
Right?
Okay, yeah.
Hi, good evening, everyone, and thank you for joining in today. We'll be just waiting. It's 5:03 now, and we're just going to wait another 2 minutes to get everyone online first. A lot of people are joining in. Hopefully, we have a good session today. Welcome to Dr. Sanjeev Rampal at rampalsurgery.com. And today we're Instagram live with my good friend, also a consultant, ear, nose, and throat consultant, and also a sleep surgeon. My good friend, Dr. Raymond Tan from Beacon Hospital, and we'll be talking to him a little bit about sleep and snoring during the pandemic, and he's going to give us his nice tips on how to get better sleep during the pandemic time. Yeah, we're going to start in about 2 minutes. Just going to let everyone join in first.
Okay, Sanjay, can you hear me?
Yeah, I
You
can.
all right?
Yeah,
Okay,
so
it's clear. Okay,
yeah.
okay, well done. Okay, good.
So just 1 more minute. Thanks for coming. Thanks for joining us, Salmia, Aling, Dr. Raki Yadav, Yoko Q, Dr. Nika, Satish. Okay, just 1 more minute and then we'll start, yeah?
Okay.
Hey, Nazira, thank you for joining us.
Hey Nazira, how are you?
Who to
And
Lim?
this is yeah, Lim, how are you? Kate Lim.
Okay, everyone, we're gonna start soon. So I'll just start off. Thank you so much for joining us on this beautiful evening in Malaysia, Kuala Lumpur. And today I'm joined with my good friend, Dr. Raymond Tan. He's a ENT, ear, nose, and throat specialist, and also sleep, a sleep surgeon, and also a treasurer of the Malaysian Sleep Disorder Society of Malaysia. So today he'll be talking a little bit about how we get good sleep during the pandemic, how the pandemic has affected our sleep, and a few tips about how to deal with snoring and OSA and also sleep. Yeah. So a little bit about Raymond Tan. Dr. Raymond Tan is the ENT specialist who graduated MBBS from Malaysia and also from FRCS ENT Glasgow. He's a consultant ENT surgeon, a snoring and sleep apnea specialist in Beacon Hospital. He's a resident over there, a good friend of mine. And today, thank you so much, Dr. Raymond, for joining us today on Instagram Live. So,
Thank you, Sanjay.
yeah, this is a public information session. So just like to remind everyone that whatever we give here is basically for patient information. It shouldn't be substituted for any consultation or any recommendations of any products or anything in that means. We are just providing patients with a little bit more information and maybe a few tips. Yeah. So, Dr. Shall we start a little bit? So I guess sleep is very important to us. The amount of sleep that everyone gets is variable from 4 hours to 8 hours to 9 hours, and the satisfaction of being well done sleep is very essential in the success of a patient's well-being and also his overall performance in life. So I myself had issues with sleep previously, with sleep apnea before, and so maybe today you can help us with dealing with sleep because it's affecting everyone and all stratas of life. And maybe we can start, Dr. Raymond Tan, with a little bit intro about yourself and your career in ENT and also with.
Hi, Sanjeev. Thank you for having me on your Insta Live health talk show. I studied in India. I did my MBBS from the All India Institute of Medical Sciences in New Delhi, and then subsequently I joined the master's program in ENT in University of Malaya, and I went on to the UK, and I was there for 3 years. I did my FRCS and ENT. I worked in several hospitals in the UK, including the St Mary's Hospital in Paddington, London. I'm also the treasurer of the Sleep Disorder Society of Malaysia, SDSM, for the past almost 10 years. So we work to promote knowledge and understanding and about the role of sleep and how we can help the people in Malaysia to deal with their sleep problems. We know that COVID-19 is a horrible pandemic, and it's affected people all over the world, and also it has definitely affected our sleep. Actually, there is a term called coronasomnia, and this term is a term which talks about medical problems associated with sleep due to the coronavirus, so that there's this term called coronasomnia. Why has COVID-19 affected sleep? Okay, we know that it has definitely disrupted our so-called norms of what we know as daily life. Okay, people are now stuck at home. They're not exposed to natural light as much as before. They don't go out as much as before, and we know that people also tend to oversleep nowadays because they don't really have to go to work. They work from home, and actually oversleeping causes people to be groggy, to be irritable, to even become unfocused. Actually, so oversleeping is not really a good thing. All right. There's also the
that's so very true. There's a term saying that you can't buy a proper sleep. Yeah, you can buy a lot of things, but not proper sleep. So what are the factors? Obviously, our COVID pandemic affected us by basically financial restrictions and also changing the behavior of our work and our workplace and the way we deal with it. That's one of the factors and financial factors. But what are the other factors that has caused COVID to affect our sleep, Raymond?
Yes, one of the most important Sanjeev, is the fact that nowadays we got more anxiety and more worry actually. With COVID affecting us, because we fear falling sick, we fear for our economic well-being, and we also worry about loved ones who may be in the high-risk group. They may be our parents, our grandparents who are not so young anymore. We worry about relatives or friends or family members who may be in high-risk groups. They may have diabetes, and they tend to fall in the high-risk group for developing a more severe COVID when they do get COVID. So we know that anxiety and worry affect sleep to a very large extent. Also, the fact that there's more depression, there's more isolation nowadays with COVID. We worry about loved ones who maybe have fallen sick with COVID. We have friends or relatives who have passed on because of COVID, and all this worrying and all these depression problems becomes heightened with being isolated at home. We also see an increase in alcohol and tobacco consumption because of all this isolation and all this depression that comes along with being stuck at home and being having so much social isolation. And we know that increasing consumption of alcohol and tobacco also leads to increased rates of depression. There's also greater family and work stress. People work from home. We have to manage a house full of children, okay? And there's also isolation from friends. We know a very sad story about Steve Bing. Actually, Steve Bing is a billionaire. He comes from the famous Bing family, and I believe he's also associated with the Bing search engine on the internet. He actually committed suicide. He couldn't. He had underlying depression, but this underlying depression was compounded by the fact that it is now a COVID world, and we've got to isolate at home. We've got to not mix with friends, and that social isolation actually drove him to commit suicide. He jumped from the roof of the top floor of his luxury condominium.
Yeah,
we know that. Yeah,
Raymond, that's so true. Can you give us a little bit about how does sleep help our well-being, basically?
Actually, sleep is so important, Sanjeev. Sleep is important because it is important for maintaining an effective immune system. We know that with COVID, having a good and effective immune system helps us to prevent us from getting a more severe disease, severe category of COVID. Okay, we get less severe COVID, or hopefully with a good immune system, we even get asymptomatic COVID. We know that sleep also heightens our brain function. It helps to improve memory, improves alertness, improves heightens creativity. Okay, it enhances mood. It keeps us having good sleep, keeps us from being depressed. So sleep is so important on so many different levels, and it's especially more important now during this pandemic, and we've got to keep our immune system up to to its optimized level.
Exactly, Dr. Raymond. What about its effects on our health? Like in what conditions? Because we got a question over here regarding hypertension and sleep. So how does sleep affect our medical diseases if they have, or does it even have an effect?
Oh, definitely. We know that sleep affects across a whole wide range of medical conditions. Actually, we know that with good sleep, we've got better blood pressure control. We also got studies done that look at the sleep and sugar control. We know that with good sleep, we have less incidence of cardiac events. They did a large study. They looked at 21,000 Greeks actually, okay, and they found that the Greeks who actually took a little short nap in the afternoon, and in Europe, I think Sanjeev would know a lot about Europe, but with you doing your training in France. In a lot of countries in Europe, it is almost mandatory. It's almost obligatory for a town or a city to even shut down during their lunch break, because it's customary there to take a siesta. And they found that in this large study done in Greece, they found a correlation between people who took a short nap in the afternoons had a 63% reduction in cardiovascular events, in heart attacks and in heart related problems. 63%, you know.
Yeah, but siesta is more in Italy and Spain, I think. Yeah.
Yeah, Italy and Spain. But even in Vietnam, actually, I met a professor, a sleep medicine professor from Vietnam, and he tells me that it is also something that the Vietnamese do actually regularly in the afternoons. They take a short nap.
Yeah. So, Dr. Raymond, can you give us a few tips on how to get better sleep for a person who doesn't have any medical illnesses, just a general person? What would you suggest, in your professional opinion, to help people with better sleep, to get better sleep?
Okay, the first thing is I would strongly recommend them to establish a sleep routine, all right, and stick to this sleep routine. So what this means is you want to sleep at the same time every night, and you want to wake up at the same time every morning, all right? Set an alarm clock and avoid from pressing the snooze button, okay? When the alarm tells you to wake up at that time, all right? It's also important to have a wind down time, okay? Before you sleep, just take half an hour to just not look at your laptops, not look at your mobile phone screens, okay? And not to be doing any work. Just do a bit of light reading, listen to some light music, all right? Just have a bit of wind down time before you sleep. Also, you want to establish a daytime routine that's as much as resembling a normal out of pandemic routine, all right? So even though you're working from home, it's also strongly advisable to shower, to get dressed, even if you're not leaving home, okay? Eat your meals at the same time each day. And also it's very important to block off time for work and for exercise, all right? You want to keep to as much as possible to a pattern where we've been living before, prior to the start of this pandemic. We also want to reserve our bed for sleep, okay? So remember that the bed is for sleep and for sex only, okay? It is not for work. You don't want to bring your laptop into your bedroom or onto your bed. You don't want to work from your bed. Just keep your bed for sleep and for sex, all right? If we cannot sleep for 20 minutes, okay, we want to leave that bed, okay? When the longer we stay in bed and try to force ourselves to sleep, then we develop negative associations. We start to, our brain then starts to hate that bed. Okay, so when we develop all these negative emotions, it then actually worsens our insomnia. Okay, we cannot sleep, just leave the bed. Also, every morning, wake up, make your bed, fluff your pillows. We want to keep our sheets clean, or the bed sheets clean, all right? We want to make the bed as comfortable and as inviting as it should be. All right. So that also helps to promote a good sleep environment.
Okay, excellent. Dr. Raymond, there's a question here. We don't have to answer it, but you can just generally give some information about it. What about better air quality in the room? Does that help with better deep sleep? Does that promote good sleep?
I think that the definitely, of course, having a good clean air is important, and we know that living next to very busy road junctions with lots of heavy traffic would worsen air pollution, and also then would give rise to poorer sleep. Okay, then we have what is known as the sick building syndrome. All right, and it's also important. Yeah.
So it does affect.
It's also, yeah, so, definitely.
So, Dr. Raymond, regarding snoring, because snoring is a common occurrence, is usually underdiagnosed and underreported, to tell you the truth, and everyone thinks that snoring is because you had a long day and you snore, but actually also obstructive apnea is not that simple. And snoring has a lot of associated problems, and most of the time the patients don't really know how snoring affects their life, and how can we prevent it, because it's a big topic. And how is snoring affecting with COVID? Yeah.
Yes, thank you, Sanjeev, for asking me that question. Obstructive sleep apnea, also known as OSA, is a condition that affects. We're looking at about up to 20% of the Malaysian population has got obstructive sleep apnea, 1 in 5. And one of the reason why this is so prevalent in Malaysia is because we are struggling with the problem of obesity in Malaysia. Malaysia is the country, the #1 country in Asia, with the highest incidence of obesity and of our people being overweight. When people put on weight, then there's more obstruction of the airway. When we look at the facial skeleton of somebody, the facial skeleton is always fixed. Okay, so it's always a battle between the container versus the contents. All right, so the container cannot expand. We already grown to our adult feature. Our bones. Dr. Sanjeev is an orthopedic. We know that our bones have fused since our late teen years. But then the contents can be increased anytime with overeating. Right? If we eat more, we develop more. We got more meat, and we got more fat in the upper airways, in the mouth, in the tongue, in the back of the throat, and this then causes obstructive sleep apnea. So how do we diagnose obstructive sleep apnea? We want to start by asking the stop questions. Okay, just ask stop. S for snoring, T for tiredness, daytime tiredness, O for observed choking at night, and P for blood pressure. Okay, when we have 2 or more yeses to these 4 questions, the patient then has a high risk for having OSA, and we should then send them for a sleep study, and the sleep study would then confirm and also would then tell us the severity of OSA. OSA is bad because it invariably causes hypertension. Okay, yeah. Whenever we have
There remains something unique about snoring is usually the person who snores really doesn't know whether he's snoring or not. So they obviously, when the person doesn't realize he's snoring, and then he kind of like avoids the topic, or he denies he has snoring, and he thinks it's just because it's when he's tired. But actually, what's your opinion about that? Is that true that the person who snores?
Yeah. Yeah, quite often the person who brings the patient to see a doctor would be the spouse of that patient or the partner of that patient, and they would report what is known as witness apneic episodes. So they would tell the doctor that I get very worried when I hear my husband or even my wife. We know that out of 4 patients, 3 are males and one would be a female. I'm very worried because my husband sleeps at night and he snores and then he stops breathing and then he coughs and then he starts breathing again. Then he stops breathing again. They say it's like a car whose battery is almost flat and you cannot start the car. So it goes pop 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 pop, brr, brr, and it goes quiet and it goes pop 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 pop, brr, brr. You know the famous NBA basketballer in the States, Shaq O'Neal. Okay, Shaq O'Neal now he's a spokesperson for the American Sleep Association, and it was his wife actually who brought him to see a doctor, and he was actually living in a state of denial. He would argue with the doctor that, you know, I'm the greatest athlete in America. I mean, a few years ago, how can I be sick? You know, how can I be suffering with what this disease that you tell me that I have? You know, and after he did a sleep study and it was shown to him that he had sleep apnea, he's now using the CPAP machine, the continuous positive airway pressure machine, to help him breathe at night, and he's actually so much more healthier now. And he's now a spokesperson for the American Sleep Association, and he's promoting a lot of creating a lot of awareness about sleep apnea. So when Sanjeev, you asked me about OSA and COVID-19, right? So there was this big study done in Finland, the FinGen study. They looked at a 260,000 population of patients, and they found that when they studied these 260,000 patients, 445 of them developed COVID-19, all right? 38 of these 445 patients had OSA, so that would come down to a statistics of 8.5% of them had OSA. And this would generally go hand in hand with the incidence of OSA in the general population in Finland. So they're looking at about 8.5% of their population that got OSA. But when you look at this subset of population, 260,000 patients, the 445 patients who developed COVID-19, 20.9% of patients requiring hospitalization with severe COVID-19 had OSA. Okay, so that is more than a doubling of the 8.5% OSA prevalence in the general population. So we know that having OSA doubled the risk of being hospitalized. Okay, in this large FinGen study. So OSA definitely is a risk factor for developing more severe COVID-19 infections. Yeah.
So Dr. Raymond, can you suggest to us a common way without, like, you know, they would say, what are the steps you can do at home, you know, home remedies that you can do to prevent snoring or deal with snoring? And when do you think they need to go and see a doctor regarding snoring?
Okay, I would say that that we should always have a high index of suspicion, okay, when it comes to OSA, all right, and if we just employ those 4 questions, the stop questions, and ask your spouse or your partner those stop questions, and try to go for a sleep study if you have the slightest doubt that the patient has got sleep apnea. Home remedies. Okay, we can start with trying to lose weight. Okay, so we want to lose weight. We want to eat a healthy diet. We want to have regular exercising. All right. We want to sleep more on the side than sleeping on the back. And the way to keep us sleeping on the side would be to sew a tennis ball into the back of our pajamas between our shoulder blades. All right. We want to keep a tennis ball there. We want to avoid alcohol. We want to avoid sleeping pills. Avoid smoking. All right. We know that smoking actually causes worsening of airway edema or swelling. All right. And we know that sleeping pills actually makes us have a worsening of the breathing stoppages, the apneic episodes. All right. But by and large, you know, Sanjeev, the treatment of obstructive sleep apnea is is using the CPAP machine, using the CPAP machine, okay? And the CPAP machine has been proven to reduce blood pressure, been proven to reduce irregular heart rhythms in patients with arrhythmias. Okay, it's been proven to reduce the incidence of heart attacks and increases alertness. You get less incidence of motor vehicle accidents because of sleepy drivers. All right.
So
And
I
patients
think
who
the main things, Dr. Raymond, because we had a problem of that. Doctors coming home after long hours in doing long shifts and having increased accidents. And we had a study done too, run by the Malaysian Medical Association, wondering what was the reasons, because doctors were losing their lives while driving home after a call and having increased incidence of accidents. So is it a major problem that
Oh, definitely. Definitely. We know that, Sanjeev, we know that fatigue and sleepiness post shift work is a real problem. Okay, and that is also compounded when we have existing sleep apnea. All right. I had a patient with obstructive sleep apnea, and he was involved in 3 accidents in 1 month, 3 motor vehicle accidents. And he tells me that he just sleeps off. There's a phenomenon called micro sleep where patients have these little episodes of micro episodes of sleep, 30 seconds or less. And it happens throughout their driving. They're driving, they just doze off, then they wake up, then they doze off, wake up. It's very scary. Yeah? And it's something that I mean, we cannot fault them. Actually, it's not due to them not trying to be alert. They are very sleepy because they get disrupted sleep because of their sleep apnea. And it doesn't matter. It doesn't matter whether they sleep for a good 8 hours, a good 10 hours. They're still going to wake up being sleepy because of their repeated apneas during the night, causes a disruption of in the normal sleep pattern and the normal sleep architecture.
Okay, Dr. Raymond, thank you so much for your information. Would you like to give us a short to all the patients that have come on, maybe a take-home message about what about sleep and tips on getting better sleep, and then we'll go to the Q&A. We got like quite a few questions. I think it's a record amount of questions been asked over here, but again, just to all our viewers, we're actually not here to give medical consultation. We're just here to give medical education and maybe a little bit more information about it. But yeah, we'll go to Q&A right after. Maybe Dr. Raymond, you'd like to give us the take-home message for today's session.
Okay, I think that the take-home message is that even though we're living in this very difficult COVID-19 times, okay, we want to also try to maintain as much as possible a normal routine, all right? A routine that sticks to what we've been doing in the past pre-COVID, and we want to wake up on time, we want to sleep on time, we want to take a little short nap in the afternoons, but not longer than 10 to 20 minutes. We don't take too long a nap, or if you take too long a nap, then it would affect our night sleep, all right? A short nap in the afternoons. Then we want to prioritize our sleep. Always consider sleep as a vital part of our well-being, all right? It's not something that is a waste of our time, all right? It's a very important part of our 24 hours of our day. And we want to wake up, we want to work, we want to eat on time, eat healthily, we want to eat lots of fruits and vegetables. Try to avoid anything that may interfere with our sleep. Try to avoid so much coffee, so much carbonated drinks, Coca-Colas and Pepsis. They all contain caffeine, all right? They can interfere with our sleep, all right? We want to exercise. Exercise, actually, regular exercise also promotes, helps helps us to sleep better at night. And we want to also have a comfortable and an inviting sleep environment. Because keep the bedroom just for sleeping, keep the bed clean and comfortable, keep the mattress clean and comfortable. We want to sleep in a cool room. Temperature is about 20 to 24. A cool room. We're going to keep the room as dark as possible. So we have, if possible, have blackout curtains. So we want to sleep at night, okay? And we want to then, in the daytime, we want to stick as much as possible, even though we're working from home, stick as much as possible to a normal, regular routine, right? And incorporate, all those tips. Yeah.
Dr. Ray, we're going to go to Q&A. So I'd like to encourage our viewers to write messages. I mean, ask our experts anything that we may help you with. So there's a question here that when is surgery needed in sleep apnea?
Okay, when we have failed the CPAP machine, all right? The CPAP machine is something that is very good actually. Okay, it helps it eliminates almost all apneic episodes. So when we have that positive, continuous positive airway pressure, where that positive flow of air into our nose and into the back of our throat, it opens up all the blocked areas. Okay, the only problem with the CPAP machine is that quite a large number. We're looking at about more than 1 in 4 of people who are not able to wear the machine at night actually, and they're not able to wear the machine because they find it uncomfortable, and some of them find it suffocating. All right, so in those subset of patients, then we can offer them sleep surgery. All right, so sleep apnea surgery would aim then at opening the airways in the nose, in the mouth, in the back of the throat. All right, to give them a better flow of air. Sometimes also, Sanjeev, doing sleep apnea surgery would then help them to wear the CPAP machine easier actually. Because when there's a lot of obstruction in the back of the airways, then the CPAP machine has got to deliver air at a higher pressure. The higher the pressure is, and if it's more than 12 centimeters of water, then the patient would then find it very difficult to wear the machine at night. It becomes very uncomfortable to have that strong blast of air going through your nose and your mouth actually. So of course the CPAP machine is still the gold standard, but then a lot of patients also would perhaps benefit from sleep apnea surgery if they cannot wear the CPAP machine.
Excellent. There's a question here by Dr. Nita. Thank you so much for your question. The question is, Dr. Raymond, how long can we take melatonin pill to support our sleep? So melatonin, a tablet. I guess.
Okay.
Yeah.
All right. Melatonin is a sleep hormone, and it's sold as supplements in a lot of countries. Unfortunately, in Malaysia, it's been banned actually. It's been banned by the Ministry of Health, but it's still available in Singapore, and I know people who go all the way to Singapore and get the melatonin from there. All right.
So basically,
the problem,
you need a solution for that, and it's not the answer basically, right?
Basically, it's not even available in Malaysia. The Ministry of Health of Malaysia has banned the sale of melatonin with or without a prescription.
Okay.
And the problem with melatonin is that the studies have not shown a conclusive benefit in melatonin supplements helping sleep actually, and that's why the Ministry of Health in Malaysia has banned the use of melatonin. All right.
Okay, there's another question by Nazira. She said, for me, less sleep because I work long hours. So I guess you have to talk to your boss about that, yeah? So, okay, there's another question here. Dr. Raymond, does sleep apnea cause hypertension?
Definitely.
Incidents where you have hypertension and sleep apnea, which do you deal first, hypertension or the apnea?
Okay, in my experience, okay, and also we look at studies, we know that with every increase in in 1 unit of the AHI, the ethnic hypopneic index, the AHI that we look upon, look at when we look at sleep study results, and also with every 1% decrease in oxygen desaturation at night, when you look at the lowest oxygen desaturation, we know that it is directly correlatable with an increase in prevalence of having hypertension. So it is a direct correlation, and they find that the desaturation of oxygen is even more critical than the increase in the ethnic hypopneic index, the events where people stop breathing, and this is because when we have an ethnic episode, the body then goes into a sympathetic response. Sympathetic response is when the body is basically encountering a dangerous situation. It's when we've accidentally fallen into the lion's enclosure in the zoo. You know, you're taking a selfie and then you trip back and fall into the lion's enclosure, and the lion is looking at you. Your heart then starts to go pitter patter. You get palpitations. Your eyes, the eye aperture then dilates. Okay. And your blood pressure shoots up. All right, your muscles start stiffening. You start getting this is all the sympathetic response. Okay, the sympathetic response, also known as a fear, flight, and fright response. The body thinks that it's dying. Actually, whenever we get apneic episodes at night, our body thinks it's dying. It then shoots out all these sympathetic hormones in the blood, adrenaline and noradrenaline, and that increases heart rate, increases blood pressure. And initially, patients have what is known as a nocturnal hypertension. They have just high blood pressure at night when they're sleeping, and daytime it goes back to normal. After a few years, they develop 24-hour hypertension. So it's always important to then treat OSA, hopefully before they even develop full-blown hypertension. So the question again, which is more important? All right, I would think that of course. We want to address both problems simultaneously. Now, if you go to the Mayo Clinic, all right, in the States, right, the Mayo Clinic is very famous for heart care, cardiology in the States. They have a whole building dedicated to sleep medicine, all right. From the entrance, you go in there, you see the statue of one of the pioneers of sleep medicine who's worked at Mayo Clinic before. And why is that so? It's because and these are the best cardiologists in America, the people who work at Mayo Clinic. They recognize the fact that if you love your patient and you want to help them with their hypertension or their heart problems, you love that patient and you want to help them 24 hours a day, correct? Yep. You don't just help them when they're awake, right? You want to help them even when they're asleep, all right? And the people who snore, who are having apnea and hypopneic episodes, they do not do so voluntarily. No, they do not. They just start snoring and start choking automatically at night, right? So when we can help them at night and we address the problems of sleep apnea at night, we know that we also then lower the blood pressure. We also lower the incidence of heart problems, heart attacks in the final outcome. So we're going to combine medicines and combine treatment for sleep apnea all at the same time.
That's excellent. Thank you so much, Dr. Raymond. And for all our viewers, you can message him or you can contact him at Beacon Hospital. Is a resident over there. If you have any other further questions or any medical information you'd like to need, I'd like to remind everyone that all the information given here is basically for patient education, not to supplement or make you buy or do any kind of medical treatment. You should see a medical doctor if you have medical symptoms. Yeah. I'd like to thank everyone for joining us. Please do join us on Tuesday, this coming Tuesday on the 3rd, where we're having a physiotherapist, John and Jason, and both of them will be talking about how we deal with back pain, physical therapy, and how to optimize physiotherapy of the back, dealing with back pain during COVID. I'd like to thank again my good friend, Dr. Raymond Tan. Thank you so much for the sleep talk. I think it's the most questions been asked before, and everyone is telling you thank you so much, Dr. Raymond, and we will see you very soon, maybe sometime later in the year. Yeah, thank you.
Okay,
Thank you so much.
thank you again. Thank you, Sanjeev, for having me. Yeah, thank you everybody for tuning in. Yeah.